Hi, my name is Gabriela.
My name is Paula.
Y mi nombre es Elisa.
And we are 3 teenagers from Educative Center Muralistas Mexicano. Coronavirus disease, COVID-19, is an infectious disease caused by a recently discovered coronavirus. Most people with COVID-19 experience mild to moderate symptoms and recover without special treatment. We thought about this application long before this coronavirus problem, but now it has become more important for people who care about their health. It's important because we need to prevent the collapse of hospitals. The active role of citizens, from children to the elderly, is essential. Sanitary measures no longer seek to eliminate the spread of the disease, but to reduce its transmission speed. It is important because it kills a lot of people and is mortal.
El modo premium y la idea de mascotas fueron nuestras ideas principales, pero no las pudimos hacer porque estábamos atrasadas en los trabajos.
This is the first design of our screens, where we put the login and sign up button. This is the homepage model, where we were going to put the tip. This is the model of first aid courses videos, where we were going to upload new videos each Friday.
Se nos hizo una buena idea de aplicación, sobre todo puede ayudar con este tema del coronavirus. Habla sobre sus planes financieros, vendiendo productos médicos.
Our marketing plan is to promote our app in Facebook, Instagram, and Twitter. We also have a web page. Our main idea is that when you enter our application, you will get tips about your health and first aid courses. Our application helps society to prevent infections or accidents and how to act in cases of first aid.
Explica el nombre y logotipo son comunes en su aplicación. Tienen que ver con la salud.
Hubo varias ideas que no surgieron cuando habíamos planeado la app original, sino que surgieron cuando estábamos leyendo los textos y completando las clases.
Yo pienso que puede ayudar con estos tipos de problemas como el coronavirus, ya que es una especie de hospital virtual.
Our future ideas is that you describe the symptoms and say what disease you could have. Also, that doctors could register to our app and help us to know what diseases could have the patients. Another one is to take photos of the symptoms, and we would like to put a pet mode and a kids zone.
Finalmente me gustaría aclarar que Technovation es una experiencia muy enriquecedora y muy bonita, puesto que te enseñan a programar, te enseñan a reconocer los problemas en una comunidad, etc.
Lo que aprendí sobre Technovation fue aprendí a programar, aprendí a cómo hacerle publicidad a la aplicación, aprendí que no es fácil hacer las aplicaciones, no es fácil buscar un nombre para la aplicación, no es fácil buscar un logo.
What I learned in this program was to work better as a team, to divide the work, how to make a business model, and most importantly, to program. The app we used were App Inventor, Mural, Power Director, Machine Learning, Trello Brands, Survey Hero, Visual Paradigm, and IBM Watson. In the register page, we have to put the name, a phone number, and a password. When you do that, you are going to log in with the things that you put. And here you have a tip and your name in welcome. Then you have options to go to first aid sections, and then you have 3 options, and when you click one of them, you go to YouTube and start a video from the video that you select. When you go to detect disease, you can take a photo of an eye and it will detect if you have conjunctivitis or you don't have conjunctivitis. In this case, you have conjunctivitis because the eye is a little bit red. And if you click exit, you can log out of your account. Finally, we would like to thank the Technovation program for giving us the opportunity to learn about entrepreneurship and programming. Also to thank our mentor who supported us through the entire application process.